A lot of people with dysglycemias have depression or anxiety and things like that because their brain is literally starving for energy. Alrighty, success secret number 11, folks, has to do with blood sugar or blood glucose. And it's really important to have healthy blood sugar levels, and it's really common with people with thyroid dysfunction and other chronic conditions to have what's called dysglycemias or unstable blood sugars. The blood sugar, like many other things in the body, needs to be within a narrow range. It can't be too high or it can't be too low, or it causes problems. The functional lab range, the functional or optimal level for blood glucose is 85 to 99. Doctors will let it go as low as 65, and they're not concerned with it being too high until you get to be diabetes, which is 126. They won't even really do anything for you if your blood sugar is between 99 and 126, which is what's called insulin resistance or prediabetes. So that's unfortunate because that condition can be reversed. Diabetes can be prevented. And if it's too low, that causes a problem too, because glucose is the main energy source for all the tissues, for all the cells in your body. It's the main energy source. And if the blood sugar is too low, which is hypoglycemia, then you're lacking in energy. But if the blood sugar is too high, your cells are lacking in energy too, because the sugar or the glucose is stuck in the bloodstream and can't get into the cells where it needs to be. And another thing about glucose is it's the main energy source for all the cells in our body, but it's the only energy source for our brain cells or our neurons. The neurons can't absorb protein or fats and utilize them for energy. And so if you have a dysglycemia, whether it be hypoglycemia or insulin resistance or, heaven forbid, diabetes, then the tissue or the organ system that suffers the most is your nervous system, your brain, because it's the only energy source for it. And that's why a lot of people with dysglycemias have depression or anxiety and things like that, because their brain is literally starving for energy. And it's really futile to try to fix or correct a thyroid condition, no matter what pattern it is, if you don't fix a dysglycemia too, because the fact that glucose is the main energy source for all the tissues in the body, including the thyroid gland. So dysglycemias need to be evaluated, identified if they're there, and addressed. They can be through natural treatment protocols. Functional medicine is an area of, or an aspect of a specialty within my practice. We can correct these dysglycemias naturally. Give the office a call. Let us check you out. First 2 visits, $50. 815-469-8500.